Hi, this is a quick video for Joan and everyone else who has trigger points in their neck and underneath their shoulder blades. So for the trigger points at the front of your spine, kind of like you can feel those bones right there, and there's usually some tender points that go all the way down to kind of inside your shoulder, your clavicle there. So what you want to do is kind of lean this way. You want to lean into it. You don't want to stretch the tissue. You want to slack this tissue. You can see the SCM muscle there, and you want to kind of get your fingers in there and wiggle it. So I'm doing this, and that interrupts the pain signal because those trigger points are very tender. So a trigger point is a muscle that's so tight that it's not getting enough blood flow. So you just need to get blood in there and then it'll relax, because a muscle needs oxygen to relax. So you see what I'm doing? So I'm kind of like just getting in there and finding any tender points and just doing a kind of a mini massage. And the reason that I'm moving my hand like that is because these are tender. So if you just push, it'll just be so tender that you're not going to want to do it. So, but if you wiggle, then you're interrupting the pain signal going to your brain. So the other side, I'll get a little closer, get into the front of your spine, maybe down into where the top of your lungs are, right there. This is the clavicle, this is the first rib right there, and feel any tender points in there, and just slack the tissue, kind of bend towards it, and wiggle, 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 and massage, massage, okay? So those are for the front of your neck. And then for underneath your arm, get your thumb right into your armpit, and then grab your shoulder blade, use the other hand on your elbow, it's leverage, and then get in there and massage that. So that whole area, this is where the shoulder blade is, and the muscles along the side of the shoulder blade, right into the back of the arm there. There's usually trigger points in there. And also there's trigger points underneath between the shoulder blade and the rib cage. So get your thumb right in there and then grab and wiggle it. You don't have to wiggle this one. So just kind of like get in there and massage. Find any tender points and just massage it. So those are for trigger points, and do those regularly. I really recommend these for everybody, okay? Because this area underneath your shoulder blade, you don't move that much. And if it's adhesed, if your shoulder blade is stuck to your rib cage, that'll cause shoulder problems, okay? You can't really stretch that, because if you try to stretch it, the whole shoulder blade just moves with you. It doesn't really stretch. So you need to massage it, or get your massage therapist to get underneath your shoulder blade, massage your subscapularis muscle, under the shoulder blade muscle, subscapularis, or the teres major minor along the side of the shoulder blade, and then the ala, or the kind of the field of your shoulder blade. Get in there, if you can reach it, and just massage any areas that are tender. Okay? Hope that helps. Bye-bye.